Hey everyone, it's Wednesday, time for Wisdom Wednesday. I've had a request to do some information on prostate and benign prostatic hypertrophy. So gonna give a little bit of time to our male patients, and for those of you that have husbands dealing with this might be of some benefit as well. But I thought before I really would dive into all the information about how to manage this particular issue, I would give you just a little bit of a brief synopsis about the prostate gland, exactly what it is. It's this tiny little gland, and it's actually part gland and part muscle, about the size of a walnut between the bladder and the rectum in men. And this particular organ serves a couple of purposes. It provides a lot of growth factors and fluid in the ejaculate for maintaining sperm and helping sperm live long enough to find an egg. It also has the purpose of just helping men remain continent, in that it has some muscular aspect of keeping urine in the bladder until voiding occurs. And so it has a lot of benefits. And what we know about this particular organ is that in 50% of men by the age of 50, it's 50% enlarged. And by the age of 80% of men have an enlarged prostate. It can start anywhere around the age of 40 for many men, and sometimes even prior to that. But it can produce symptoms of just increased frequency. It can present with nocturia or nighttime urination. It can present with problems with straining, problems with interrupted voiding, and ultimately at its worst can prevent voiding altogether and residual urine, and can require catheterization and therefore treatment. So generally speaking, this is a benign condition when it starts to enlarge. It's not necessarily related to any cancer, but certainly it causes concern for many men. And many people believe that if you live long enough, men will have developed some type of cancer in this organ. So we want to take off the glasses of just regular allopathic medicine and look at it from a functional standpoint, and kind of peel back and go, well, why does this happen? This is just like women in breast cancer. About 1 in 8 men will get a prostate cancer in their lifetime, and same for women. And when you look at risk factors, they're very similar in terms of insulin resistance. You know, we talk about that an awful lot. And for men to try to prevent these types of problems, it's really coming down to lifestyle. And so therefore we want to be aware of that and do all we can from a preventive standpoint. But if you should develop enlargement of this particular gland, then you can either kind of have just watchful waiting if there's not a lot of symptoms. The best way to assess enlargement just with a physical exam is just what we call a digital rectal exam, because it's right there between the bladder and the rectum, and with a rectal exam it's easily accessible with just the hand exam. And if there's some enlargement, then you can just watchful waiting and just see if anything occurs there. There are medications. These medications came about late 80s, early 90s, and they have some benefit to perhaps slow this enlargement. But at the end of the day, 30% of people really become resistant to these medications. And so you have to look at further types of treatment. And one of those treatments that became very popular in the 60s and 70s was a treatment called a TURP, a transurethral resection of the prostate. And basically what it was a small device that would go through the urethra and, just like a tiny little spoon, just pull out small little snippets of tissue. Now, bleeding was a significant risk factor with this particular type of treatment, as well as infection. but it was the most common surgical procedure back in the 70s and 80s. And now we have these medications, but now there is a newer treatment that I just wanted to mention, and it's called aquablation. So aqua being water, ablation meaning just ablating, getting rid of this type of tissue. And it's a very interesting procedure in that it uses ultrasound, a small probe. A patient is put to sleep for this particular procedure, but it's very quick. And where a transurethral resection would take anywhere from 20 to 30, 45 minutes, this can be done because it's computer generated, it's robotically done using this ultrasound and the transurethral approach. And it's using water, just a high pressured water sort of slicing of the tissue to ablate it. And it usually takes anywhere from 3 to 5 minutes, maybe 5 or 10 minutes just for setup and setting the robot and the computer up, utilizing the ultrasound, but seems to be very safe. And the benefits of this type of procedure is that it preserves not only erectile function, but preserves ejaculate function, because one of the things that can happen with some of these procedures is that can cause either retrograde ejaculate back into the bladder, or it can reduce the risk, and up to 70-80% of people will no longer be able to ejaculate. So this can be a really sparing procedure, and seemingly with significantly less risk, less time, less risk of infection, less risk of bleeding. So aquablation is sort of the new approach. Now, this doesn't really cover looking at prostate cancer. We'll look further at that as time goes on. But today I just wanted to visit this benign prostatic hypertrophy, or an enlarged prostate gland, which is exceedingly common and can present with many symptoms. Something that can be watched, something that can be treated with oral medication, but generally does not last long term. It's a good short-term fix. And then looking at other ways that we can reduce the impact of that prostate gland by either removing it mechanically or with this aqua procedure, this aqua ablation. Hopefully that's given you some new information that might be of some benefit, something to look into. We certainly don't provide that procedure here, but I thought I would just, as a just public service announcement, just give you some information if you're not aware of this particular procedure. Hope you all have a great week, and we'll talk again next week.